Live now. Good afternoon, ladies and gentlemen, members of the public, our viewing audience. I'd like to bring this meeting of the Community Safety Standing Policy Committee to order for March 11th, 2021. We do start our meeting at 1:30, so we're pretty much right on schedule. I have the privilege as the chairman, as chairing this meeting. My name is Ryan Parker, councillor. Before we move forward, I'll do the acknowledgement statement, and then we'll lead into a roll call. And then we also have some introductions because I see some new faces, and we'll be seeing some faces departing us, which saddens me as well. But before we go into that, I'll read the acknowledgement statement. The City of Lethbridge acknowledges that we are gathered on the lands of the Blackfoot people of the Canadian Plains and pays respect to the Blackfoot people past, present, and future, while recognizing and respecting the cultural heritage, beliefs, and relationships to the land. The City of Lethbridge is also home to the Métis Nation of Alberta, Region Number 3. Mr. Sarsfield, would you please do a roll call?
Thank you, Mr. Chair. The members of the Community Safety Standing Policy Committee, Councillor Parker.
Present.
Councillor Campbell.
Present.
Councillor Higgin. Councillor Higgin. Councillor Morrow.
Yeah.
So 3 members of the committee are here, so you have quorum. In addition, inside the council chamber from the city clerks, you have Janessa Brown and myself. And in addition, we have the police chief, Shaheen Maduza, as well as the city manager and members of community services.
Thank you very much. And I see a new face on there, and I do believe that is Mr. Michael Fox, who is now our Director of Community Services, who's just joined our team. And so first of all, congratulations, Mr. Fox, and welcome to the City of Lethbridge. I know that you'll love being not only within this corporation, but more importantly, the city as itself, because it's a great city. I also want to thank Mr. Greg Adair, and I think Mr. Adair has been in the position as temporary, probably for almost a year, almost to the year when we started this whole pandemic, which was actually, ironically, a year ago today that the pandemic was first became public and it was officially announced. But Mr. Adair, I want to thank you very much for all the advice, all the guidance that you've not only given council, but our administration. You've been first class, and I just want to say thank you on behalf of not only the council, but the community. It's greatly appreciated. Thank you.
Thank you.
You're still going to stick around for this meeting, right?
Oh, yeah.
Excellent.
Wouldn't miss it.
I see you're on the end of your chair. Perfect. And is there any other faces? Mr. Dalton, I know that you're joining us. Is there any other faces that you would like to just introduce at all, Mr. Dalton?
No, Mr. Chair, just thanks very much for welcoming Mike and for acknowledging Greg, because you saved me from doing that, but really appreciate that. I would just note that for the presentation today, we have Chief Maduza with us as well, which David mentioned, and so we're ready to get going whenever the committee wishes.
And thank you, and I also thank you, Mr. Mayor, for joining us as well today. And this is also, all members of council have been invited to come and watch the meeting as well. So thank you very much as well. And of course, this is live streamed. Before we move forward, I'll just get an adoption of the agenda. And I don't believe we need a vote on this. Is it just by consensus, or do we need a motion? Why don't we do a motion? Can I get a motion to adopt the agenda at this time? By Councillor Campbell. All in favor? If I don't hear anything, I'm going to take it as consensus. I don't think we're going to need a roll call and all that. Can I get a motion to accept the minutes for February 11th, 2021? Councillor Campbell, thank you very much. All those in favor? Carries. Perfect. As you can see, our agenda isn't jam-packed, but it does have a very important issue on it today, and that is item 4.1, Martin Thompson, Manager of Community Social Development, regarding the Community Wellbeing and Safety Strategy, CWSS Phase 2. So this is going to be kind of an update, because I know we heard the first one, but I think this has been updated as well. So I'm all ears, as well as the community and our committee members. And Mr. Thompson, you probably have some people you want to introduce as well.
Okay, thank you.
Or Craig, you can start off if you like.
Thanks, Mr. Chair. Yeah, and I'll do that briefly. And I should have highlighted and didn't mention Dr. Alina Turner's joined us today and has been involved in this work with Marty and team for quite some time. We're here to provide an update to the committee, and we're at a critical juncture in implementing the community wellbeing and safety strategy. And we've said this a number of times in front of council, but just to emphasize again what a good piece of work this is, and how fortunate we are to be able to move forward on a solid base of evidence and research. And I do think we think rather, that we're at a really critical time. And so we wanted to share this update brief with the committee. And then when Marty's done, I'll talk about some of the next steps that we think it's important that that committee and all of council knows about before we continue down this road. So I'll turn it over to Marty.
Thank you, Mr. Dalton.
Thank you, folks, and I will get Janessa, if you could please load our presentation. And while she's doing that, I'm going to provide about a 10-minute presentation. It has a little more context for our public viewing audience in case they're not familiar with this project, and so I'm going to provide a little bit of a context. And then, as Craig said, we're going to talk about some of the proposed next steps. So next slide, please, Janessa. So the city of Lethbridge, we know, has a social policy. We will never be a city free of social issues. That's impossible. But we cannot overlook our social problems, as it can and will cripple our city. We have seen firsthand the devastating costs relating to social issues, the sheer number of lives lost and families destroyed. The financial cost is staggering. The cost to deliver social programs, the cost for emergency response, such as ambulance services and emergency room visits, ongoing healthcare costs, including mental health care, our policing, court, and correctional costs, the negative impact on our business community, and our school systems spend tremendous time and effort addressing student issues such as mental health, addiction, poverty, and trauma. So social well-being and community safety is a win-win for all of us, but we cannot hope or simply hope things get better, as hope is not a strategy. Next slide, please. A healthy city is defined by 3 pillars: our physical, institutional, and social infrastructure. But we need to evolve. We can no longer ignore strategic planning for social infrastructure. Like our physical and institutional infrastructure, we need a made-for-Lethbridge strategy grounded in evidence, and one that leverages all resources. Next slide, please. Lethbridge has always had social issues, but over the past 4 years, we have experienced unprecedented converging factors that have supersized our problems. The opioid meth crisis, mental health issues, and homelessness have significantly increased. Drug and substance abuse is the #1 cause of homelessness in Canada. And this is, I believe, the beginning. The ripple effects of COVID are going to significantly increase our social issues. And we are a hub city to over 340,000 people and have significant migration to our community where vulnerable people access social services not available in smaller communities. These issues in turn have impacted our community safety and crime rates, which puts direct pressure on the police. Next slide, please. A solid strategy requires an in-depth needs assessment. We need to define the problems before we can create solutions. That exhaustive work has been completed through data collection and analysis, extensive stakeholder engagement. We reviewed and mapped all historical and current efforts. We completed social asset mapping, and twice we brought together all key stakeholders to review all the info and data and map out a strategy. So to be clear, this strategy was not developed in isolation. It was co-created by the community. Next slide, please. Our city has evolved. We are not a town anymore. We've hit 100,000 people and we're the 3rd largest city in Alberta. And again, we are a hub city for business, healthcare, education, entertainment, and social services, which means we will naturally attract the vulnerable population. We are experiencing urbanization, and urbanization equals increased social pressures. This is a high-level summary of the hundreds, thousands of hours of work in a 124-page document. Lethbridge has unique demographics. We have high numbers of newcomers, seniors, children, and people with disabilities. We border the largest reserve in Canada, and the Indigenous population is the fastest growing demographic in Canada. From a basic need perspective, we are a low-income community, and we have one of the highest child poverty rates in Canada. We have a housing affordability problem, and our homelessness rate is growing at one of the fastest rates in Canada. From a health and safety perspective, our domestic violence rate is higher than the provincial average. Our mortality rate is 47% higher than the provincial average. We have a severe addiction and mental health issues, and FASD is a significant problem in Lethbridge. And again, all of these factors have placed immense demands on our police. Next slide, please. In addition to the needs assessment, we completed social asset mapping to determine exactly how many social assets or resources we have in Lethbridge, with the end goal of coordinating and leveraging the collective horsepower of all of these resources. The City of Lethbridge cannot own or solve these issues alone. It's a community problem that requires a community solution. What we determined is we have a tremendous amount of resources in our community offered by government, nonprofit, for-profit, and private organizations. And we are not done. Every day we learn of more and more programs and services and resources in the system. So the goal is we need to identify and, more importantly, leverage all available resources to tackle this problem. Next slide, please. We also completed a social impact audit, which is a systematic approach to capture and analyze all funding sources at the service delivery level and assess key performance indicators to validate return on investment. So although we have ample resources, programs, and services available to leverage, the pain point is we are not moving the needle. The situation is not getting better. But therein lies a tremendous opportunity. We have the resources we need. We have passionate, hardworking people delivering great programs and services. The opportunity is bringing everybody to the table to coordinate our resources and efforts to generate community-wide collective impact. Next slide, please. What we also learned is that the City of Lethbridge is a key contributor to the problem. Within city administration, we had many overlapping initiatives, multiple strategies, an array of different funding sources, all working in an uncoordinated fashion, creating layers of administrative bureaucracy with little to no performance management for the dollars and time invested. And we are not alone. The provincial and federal governments who fund or deliver most of the programs are equally to blame. Next slide. Again, I say this is not a crisis, rather an opportunity. Again, we have the resources, people, and programs to move forward. The City of Lethbridge needs to take a leadership role to create a coordinated system with a common vision, clear goals and objectives, and performance measures to accelerate collective impact. Next slide, please. So, individual well-being, what does success look like? What does it mean when we say we need to move the needle? It means individuals and families are achieving a state of well-being. Well-being is a recovery-based model, and well-being is different for everybody. For some, it may be short-term rent supplement to help them secure affordable housing. But for others, it may be a lifelong journey. Many of our homeless folks have brain damage, much of it caused by FASD. Other medical issues such as HIV, heart disease, eyesight problems, physical disabilities, mental health issues, addiction, and a plethora of criminal charges. Achieving well-being for those folks requires the entire system to operate in a coordinated fashion across all dimensions of well-being, to integrate services, to achieve sustainable well-being. And we all must work together to share, analyze, measure, and report data. Next slide, please. Next slide, please. System integration, system coordination and integration of this magnitude does not happen on its own. especially when various levels of government are involved. We need purposeful system-wide planning to coordinate and integrate our resources, programs, and services. A disciplined cross-sector approach that connects the dots between the various domains to generate individual well-being. Next slide, please. If we can do this, if we as a community can do this, we will achieve collective impact. Collective impact requires us to come together to create a shared vision and common agenda, shared outcome design and measurement, coordinated and mutually reinforcing activities. And for collective impact to be successful, it requires a facilitator, coordinator, and convener of the movement. Next slide, please. And the fourth concept of the CWSS, community governance. One organization alone cannot generate collective impact. You need key organizations and players at the table, a collective of decision makers from the community, all levels of government, key organizations, and the police role is critical. Because social issues such as addiction, mental health, and homelessness directly impact policing, we need to partner with the police to enhance collaboration between policing and social programming, to accelerate collective impact and elevate effectiveness. This entire group needs to solidify to generate that common agenda. And what is the city's role in all of this? The city needs to take a leadership role to facilitate, coordinate, and convene the movement. Next slide, please. So as you remember, City Council approved the CWSS on May 13, 2019, and we employed a two-phased approach. In phase one, we applied the CWSS concepts internally to community social development, or CSD, controlled strategies, committees, and funding portfolios. In phase two, similar to phase one, except we apply the CWSS concepts community-wide to generate some serious horsepower and collective impact to address our social issues. Next slide, please. So how did we do? A lot of work has been done since that time period. And we have employed a system-wide lens to coordinate and integrate hundreds of programs and services within the CSD social service ecosystem. We developed and implemented an integrated investment strategy where we consolidated all CSD funding pots, which equated to about 26 million over 4 years, to fund that new integrated system we designed. And we implemented a performance management system at both the program and system level to measure progress and promote accountability. Next slide, please. In phase one, we created an interim CWSS advisory committee of key stakeholders. You can see on the left of the slide there all of the stakeholders we involved. This group provided oversight and direction and made funding allocation recommendations to be approved by City Council. And again, the city's role was that of a facilitator, convener, and coordinator. Next slide, please. Any strategy, a strong strategy, requires targets and ongoing measurement. As part of our work, we established evidence-based targets with key performance indicators and have incorporated performance management into the agreements to ensure accountability. Next slide, please. So again, in phase one, we focused only on the internal community social development portfolio. And realistically, the overall community impact will be minimal. True collective impact will come if we can catalyze cross-sector action across the entire community. The city alone cannot solve this problem. This is a community problem that requires a collective effort. So in phase two, we need to bring together the city of Lethbridge, together with all key stakeholders, including the police, the education system, all levels of government, the faith community, and civil society to generate collective impact. Next slide, please. So we have been working on this for a number of years now, And as a business unit, we're very small, we have limited resources, and there's only so much we can do. And this is where we need your help. We need your help to restructure our system, to leverage and coordinate all resources in the community to generate that collective impact. We need to construct a new community governance model with a mandate to accelerate community well-being and safety, with a common vision, clear goals and objectives, performance management and accountability. And we need to champion social and tech innovation and leverage research to transform towards an agile, proactive, and effective system. Thank you, and I will turn the floor back over to Craig Dalton.
Thanks, Marty. And what I'd like to do is just emphasize a few points Marty made, and then ask Chief Mediciday to share his comments as well, because as Marty mentioned, LPS is a critical player, a key player in the community in responding to and helping manage these issues. And he has, since his arrival, been part of this journey, working with Marty and the city on next steps. I'd really like to just pick out a few key words that Marty shared and highlight the fact that we are at this, and Marty used the word opportunity a number of times. And I really think that's what we're facing here is not just a challenge, but a real opportunity to go from phase one of this CWSS into this community collective impact approach. And collective impact isn't easy. It doesn't happen overnight, but it requires leadership and it requires us to start. And the KPMG report and review of LPS highlighted that. And one of their key recommendations was that the city and LPS take a greater leadership role in moving the community forward and how we respond to these issues. So I think the opportunity piece is critical. I'd also just like to highlight when Marty talked about facilitate, coordinate, and convene. The city can't compel action in many, many areas that are required to help us move forward in how we respond to social challenges. In some cases, it's the work of hardworking and very capable community partners. And in other cases, it's under the jurisdiction of provincial ministries and or the federal government. So our role is very much that of facilitate, coordinate, and convene. But you can also define facilitate and coordinate and convene as a way of leadership. And so that's what we're really seeking to do here, is to partner with folks, but find a way to lead the community to this next step, this collective impact approach. I think it's really important to acknowledge that this is not a condemnation of the work that's going on now or the work that's gone on for a number of years. It's about recognizing that there are new and evolving approaches for communities to consider as they respond to these issues. And collective impact is first among equals, if you will, in how to get communities ultimately to work together, as Marty said, around a shared vision, common goals and objectives, measuring outcomes, individual and collective accountability, and we think we're at that point. We've developed three options. The ink's not quite dry on how we would like to see or recommend to council how they might see this move to collective impact. We weren't ready to share those today, unfortunately, and we didn't want to wait another month for this committee to meet again. So we're here in front of the committee today, but we will be sharing these three options with council in the coming days, because over the next month to 6 weeks before we come back in front of the committee, we're going to be doing some pretty broad stakeholder engagement. Some of those conversations have already taken place, but again, in the coming days before we start that engagement in earnest, we'll share with council what we're going to be taking to the community so that council's aware, should they get questions, should they have comments. And my last point is we know that the community is looking for action. And this is not another navel-gazing, let's take a year to decide how to build the perfect mousetrap. Perfect is the enemy of good enough. This is about getting going, putting something in motion, and building on it and improving on it as we go. So I'll stop there and just ask Chief Mediciday if he has anything he'd like to add for the committee.
Before we go to the chief there, so first of all, thank you, Mr. Dalton. I appreciate summing that up and kind of paraphrasing everything together there. I just want to acknowledge that Councillor Hagan has joined us as well. And I do believe that the police chief and the commission had an opportunity to see this presentation as well at your last commission meeting, am I correct? Which is a great news story. So you have a little more understanding of it because you have an opportunity to already soak on it or soak it in and all that. So Chief, we'll go right to you. I just want to make sure that I got it all out there. And my last question, before we go on to the Chief, Mr. Dalton, is there an expectation that this committee will be looking through these options and making a recommendation to council? Or do you think the council should see all the options and then council as a whole would make the recommendation?
We're happy to proceed either way, Mr. Chair, whether it's back to this committee or to council. But in 4 to 6 weeks, our intent is to be back in front of either one of those bodies with the results of that engagement with the public and those 3 options for consideration.
Thank you very much. Thank you. Thank you. Thanks, Chief, for your patience. So please feel free to add.
Sure. Thank you very much. And I don't have a lot more to add. Craig has really explained everything the way it goes. I'm just quite excited to be part of this process and doing what we can from our perspective to help this community. As you all know, the challenges in this community or any other community I've been to, obviously a lot of it falls on the police, but police are not the right people to actually deal with them. But again, police has become a de facto for everything, and as other organizations wash their hands off of some of the things that they have the expertise and horsepower to do, it always falls on the police, and we can never say no. We have to do whatever we can to make sure the community is safe. So I'm quite excited to be part of this and provide anything we need to make this happen. The biggest piece that I'm really looking forward, because this is it's a new concept in the sense of that accountability, but it's not a new concept as far as the model itself. There has been many models that people come from different agencies, they get together, have a great discussion, and everybody walks away, and really nothing comes back. What I'm hoping this committee, task force, whatever you want to call it, what it's going to accomplish is that accountability, that when they come to the table, they're coming with a purpose, they're making commitments and actually living up to those commitments moving forward, which is, I think, going to be the angle that I'm really looking forward to, and whatever I can do to contribute, I'm looking forward to that. So thanks to the city and to all the people who did a lot of work to make this moving forward. Thank you.
Thanks, Chief, and thanks for all your hard work as well behind the scenes. It's greatly appreciated. Members of the committee, do you have any questions of Mr. Thompson or anyone else who has spoken to this point? I'll start off with the questions, if I may. We want to take this out to the public, which I think is a great idea, and obviously taking this out to the public is a lot different than it was over a year ago. How are you planning to go about doing that and getting feedback from the community, Mr. Dalton?
I'll share a few comments and then I'll ask others to chime in. So it'll largely be like this. It'll be a number of Teams meetings, but we've had a number of conversations recently, and I know Marty and Dr. Turner have done considerable engagement to get to this point. But there are obviously a lot of interested parties in the community around these issues. Some of those conversations are ongoing, so we're just going to introduce that information into those conversations. But our intent will be to try and reach as wide a population as possible of both individuals and stakeholder groups, private sector, the not-for-profit sector, people with lived experience, Indigenous partners, to try and bring as much feedback and adjustment. Those 3 options that we're taking out are just the start of a conversation, but our intent is to get as much of that done as we can within the current constraints and bring it back to the committee and or council.
Thank you, Mr. Dalton. Councillor Campbell?
Thank you, Mr. Chair. Thanks everybody for all the great work. Marty and Dr. Turner, it's great to see you again. You say on a number of times that we have the resources to go forward. Now, when you say resources, are we talking, is that on a human level? Because I'm just thinking in terms of, we need housing, we need homeless shelters, we need intox, detox, those things. Is that not considered the resource, or is it the human part that we have the resource that enables us to get to the physical part? Because that's what I'm just, if I could get some clarification on what you mean by we have the resources.
So I will let Dr. Turner follow up on this answer also, because she's done a lot of that background work. But again, it's that collective of all of our social assets in our community from all three levels of government. And when you put it down on paper and you add up the dollars and you see all of the resources that are there, it's quite high. It is now, how do you collectively coordinate and bring those together? And so, you know, the data that we pulled, again, from the Canada Revenue Agency and a number of different sources do indicate that not only our community, but other communities indeed do have ample resources. And I'll let Alina give a little bit of the background and the methodology on collecting that info.
Yeah, no problem, Marty, and thanks. We've had the opportunity, because of the RFSQ process, to not only get the CRA data, audits on these the organizations that are delivering social and community services, but through the RFSQ, we've been able to also ask further, who else is funding you and what are they funding you for? And then take that information and go to those funders, primarily lots of it being provincial, with nobody being surprised about that. So children's services, homeless services, the feds to some extent, and say, hey, I'm interested that you're co-funding in this space. Is there a way that we could exchange notes on what you're doing and what you're trying to achieve in Lethbridge, and what the city's doing and trying to achieve in Lethbridge, and see if we can streamline some of this? And that's exactly where we need this new phase 2 teeth, if you will, because those conversations can only go so far from an administration perspective. We don't have any teeth to say, well, the municipality has done all this work and is saying we have more pressures over here. We need to take that $100 million and really focus in on exactly what was mentioned: detox, supportive housing, addiction treatment. But we're seeing that the money is actually going in these areas, and PS, that's great, but the pressure point is over here. So how do we get those decision makers at the table to have look at it as like an investment approach? So how do we take this taxpayer investment into social services and make sure it's getting the best ROI for everyone, and it's hitting it on in terms of priorities? The same thing is happening though in other parts of the country, which is now lending itself to another level of analysis. So Edmonton just went through this process. Calgary's gone through this process. So lots of the communities across Alberta are similarly asking exactly what you guys were asking 2 years ago. They're kind of getting to it now. So now the ability is to say, how is Lethbridge faring in what we're getting on a per capita basis compared to similar sized communities in different parts of the country and in Alberta? And then is there an optimal service mix that we should be that we should have, so that because that lends itself to better outcomes in these social areas, social arenas. So it's now moving us from, hey, let's just get a sense of what's happening and who's doing what. That's great, but let's push it further to say, now that we know that, how do we move the system to actually respond at that level? But to do that, we need this next phase to come through, because Marty and Craig obviously do not have the authority to influence the 100 million. The things that the city could influence, you guys already did. You ripped all of those band-aids off and you started over again, and you're doing the heavy lifting already. You're doing that. But how do we get the other 95% of that 100 million to do the same, to line up in the same direction with us, and to do that in a collective impact manner where everybody buys in and sees the return? So hopefully that helped.
So going forward, I mean, and this group will be coming together, and I'm thinking specifically of, we have $11 million to go into supportive housing. It hasn't started yet. Is this part of what is going forward is going to be about getting together and saying, here's how we thank you for the government for this, but we need to move.
Yeah. Yeah,
So
I mean,
that,
I'll defer to Craig and Marty on those because they're working actively on the PSH file. So
right. Okay.
I would add that that I think what we would see this action committee, this table, this task force doing is if not executing, coordinating the implementation of, for example, the affordable housing strategy by having a level of expertise in housing that exists in some of the community partners we have now to come together and collectively move that forward, as opposed to the city behind the scenes trying to control is the wrong word, but trying to manage something it really can't manage. So that is the intent, and that is part of collective impact. And hopefully, as Dr. Turner said, we can't direct people to participate and do this, but hopefully through this collective impact model, you build that willingness to participate and be part of an effort towards that shared vision. And so that's what the intent of this would be.
Great. Thank you. Thank you very much. Thank you, Mr. Chair.
Thank you, Councillor Campbell. Councillor Higgin?
Thank you. Actually, Mr. Chair, mine is more of debate, so maybe I'll wait for closing. It's definitely more comments than questions, so I can wait for debate. Thank you.
So why don't we just say not so much debate, but more comments. Mayor Spearman?
Thank you. I like the community involvement. I think the piece that we seem to be afraid to say is there needs to be leadership and advocacy. And I'm quite happy, to certainly develop an advocacy, work with people to develop an advocacy plan. We have some political challenges, to be honest. There's funding shortages at the provincial government. We need to work with them, and we need a connection to the decision makers federally that doesn't presently exist. But I'm quite happy to make representations. There just needs to be an advocacy plan, and I think we need to define that plan. So what happens in what order? So it sounds like community consensus. When we have community consensus, when will that be achieved by? And then following that, what's the timeline for political advocacy?
I think
so those are my, am I right? That's my question.
I think you do have some good points.
Aside from political advocacy, that seems to be leadership and advocacy. What's needed, and what has to take place before that steps into gear.
I have to echo. I just want to echo the mayor there, because I do agree with you, because we can keep on, for lack of a better, kick the can down the road, but we really need to set a deadline, and then have the deadline, execute on the deadline, and then put the political pressure on our partners, other orders of government, to make actions occur. And I think Mr. Mayor, that's what you were saying, is we need a deadline, and then we need to put the action in plan and put it in front of the people that make the big decisions as well, both at the provincial and federal level. Am I right?
Yes.
Thank you. Mr. Dalton, did you want to add to that?
Yeah, so I'm just going to say exactly. So this is not an exercise solely in community consultation. This is to build an action table. This is to build that body that will execute and deliver CWSS and the affordable housing strategy, and over time, any other plans and strategies that are designed to respond to social challenges in the community. And that body will be responsive from a governance perspective. We would see back to this committee and through this committee to council. One of the benefits of this body is, instead of disjointed advocacy going up functional lines, and somebody in the community has a connection to a particular provincial government ministry or knows a federal official, this body will help council in that advocacy role by clarifying what those main issues are of need, what the priorities are, and it will better enable the council to play that political role. So this is not one or the other. That the advocacy is very much part of collective impact, and I would say what you get there is better informed advocacy.
Thank you, Mr. Dalton. I do believe the police chief wanted to add to this as well.
Yes, my apologies if I'm out of line here. I'm not into politics, but as Mr. Mayor was saying about advocacy groups, and and getting different levels of government to come together. Uh, One option maybe is why not actually, when at your level, sir, try to actually convince both province and the feds to do it as a pilot for a while, and because when at least things that the people are trying with really no investment really that they need to continue, but at least doing it as a trial and capture the evidence and the facts and all the evidence behind it to move forward, it might be a much easier discussion moving forward, because they can, again, having been with the RCMP for many years, I know how these wheels turn very slow, but sometimes when there's evidence behind it through at least trying it for a period, it makes for much easier discussions. Sorry to, again, if I'm out of line, my apologies.
First of all, you're not out of line at all, and that's why you're part of this, is we want to hear what you have to say, and everything you say is important. So thank you to add to that. Mr. City Manager?
Yeah, thanks. And I think that's a great point. I do think there's a potential for us, and Dr. Turner alluded to this, and that other cities are going down this path now. We're out ahead. And I think there's a real opportunity for us to show leadership. And I believe, in talking to individuals in a number of provincial government ministries, that they would very much like to see this approaches like this taken place everywhere, because it helps them understand. One, it helps at the end of the day get bang for buck, if you will, have a much better sense of whether outcomes are being achieved or what outcomes are being achieved for investment. I can tell you the province is looking at investing in programs that'll help them measure these types of things to support how they allocate grants. So I think, to the chief's point about a pilot, I think from a provincial perspective, we could very much pitch that this way and say, hey, look, we're ready to go. We're taking the next step, if you will, or a new approach that folks across this sector, across the country, believe is the way forward. How about you work with us? And let's demonstrate what we can achieve through this effort. So I think that's a great point.
Questions or comments? Councillor Morrow?
Thank you, Mr. Chair. Yeah, just a couple of questions. Excuse me. I'm looking at the second last slide, the CWSS Phase 2 next steps, and I want to make sure that we highlight this point because I think it's important. It says defunding the police and giving money to another social service program is not the answer. So I just want to make sure, because I know that we've been pressured, I think, not only in Lethbridge but everywhere, about this defunding the police movement and taking that money and handing it over to whoever to provide the services. So can maybe whoever wants to just elaborate on that, because quite frankly, I'm of the belief that defunding the police is not the right thing to do, and I see you've got that in your presentation. So can somebody just comment on that?
Maybe Marty or Dr. Turner?
I can comment on that. Thank you. So again, as you know, there's movements across North America to defund the police. And my message there, it's not about defunding one organization over the other or defunding the police. It's about, if you can imagine, we identify all of the dollars and resources that we have and put it in the middle. And we know what the problems are. We've defined the problems. And so we put those dollars in the table, and instead of working in silos and taking money away from one group or the other, we collectively work as a team to, again, identify the problems and then collectively work on the solutions and coordinate and integrate and measure it. And so, again, simply taking dollars away from one, be it ministry or the police or one department, to give it to the other is not the answer. I don't know, Alina, if you want to add to that.
I'll speak for what I'm seeing in other communities, because it's not a let's downplay the importance of the BIPOC movement. Not at all. It's the transformation of policing is absolutely still important from that perspective. The focus on moving money, relatively small amounts of money around in a fragmented, pretty kind of uncoordinated coordinated system that is way, way bigger than policing is just missing the bigger picture. So I'll use Edmonton as the example because I did a deep dive on their policing budget and EMS and fire, and I think it's relevant across the country. But in Edmonton, the social spending was about $7.5 billion annually. Policing budget was $470 million. And the ask to council was to move 10 million. So you can just think about that. What's 10 million moving from one part to another when you haven't really done the deep dive on the fragmented 7.5 billion? You know, what's that going to do? And if you can tell me what the line of sight is to outcomes, then that's great. But that wasn't even part of the discussion. So absolutely, we should be moving around and thinking about where we want to double down for outcomes, but to do it myopically without looking at the whole thing is just, you know, it's probably going to add to the pressures. And right now, policing is picking up majority of the social safety net downfalls. So is that the solution? And I don't believe it is. Now, again, it's not to take away from the need to work on reconciliation and Black Lives Matter at all. So I think we need to kind of separate those two conversations around the funding piece. But Craig, maybe you have thoughts too.
No, I would just defer to the chief on this one. I think you and Marty have covered our layperson's perspective, but the chief may have something.
Chief, did you want to help, or did you want to add to that, to the question Councillor Morrow had?
Sure. As I have mentioned before, it's not that I'm opposing any idea to make the community safer, but when people talk about defunding the police, I really have to know what they mean. What is the definition of that? Right now, I don't believe there's a way that we can defund the police with what we have, because we are still living in an environment where people call us for any minor thing. We go to calls where we have to talk to people's kids to go to school. Again, that's just the nature of the communities we are serving and the expectation on the police. When we talk about mental health, every time there's a mental health issue, regardless of who attends, we have to be there to make sure people are safe dealing with that situation. Now, I have a vision that if we had, instead of a police station, have a community safety station where we have police, mental health doctors, everybody in there, so when the calls come in, somebody can go, and even if we had to bring someone for assessment, bring him right to the office for a doctor to assess him right away, get him the support. That would be the Cadillac model of providing community safety. But again, we can't go there. But again, the discussion comes when people are very free to throw defund the police, put the money into other programs. But having done same case of addictions, for example, I've done a lot of drug work, and I've spent a lot of time with people who suffer from that. And all the money in the world can't help one person if they don't choose to change their life and leave that addiction. At the end of the day, it is important to have the support for them when they make that decision, but it's not that you can force somebody into to giving up that addiction, etc. So bottom line is that defunding the police is certainly a discussion that I'm willing to have with anyone, but they have to define what does that mean. So if say 10 million in case of Edmonton, $10 million of their budget is taken away, what is the $10 million less service they're going to give the community? Because I can guarantee you they still have to give the same service despite taking that money away.
And I don't want to get on my soapbox here. I don't even like to use the words defund the police. I think that was a popular term, and it was very punitive in regards to some of the issues that are occurring more on the southern side of the border. And not to take anything lightly from it, but I don't want to paint all police services with this motto, that this defund the police mentality, because I too, like Councillor Morrow, I'm not on that page at all, but I think it just becomes such a, for lack of a term, a cliche over the last few months that I think words matter, and I think it's very important that we be careful of the words that we use when we use the words, because I think defund the police means different things to different people. I think it's more in regards to maybe allocating funds, not defunding the police, but maybe allocating funds through other social services. That's how it could be interpreted as well. So that's just my perspective. And I appreciate your comments as well, Chief. Before I move to Mayor Spearman, Councillor Morrow, did you have any other questions?
Sorry.
You had a second question,
yes,
didn't you?
Yes, I do. Thank you, Mr. Chair. First of all, thank you to the all of you that responded. I appreciate your answers, and I tend to agree with you. So I've been around council for quite a while, and I've always had issues with how. I guess let me maybe back up by saying there was a comment made by Marty that part of the problem, and I don't know how much of the problem, but part of the problem, I think Marty said was, all levels of government, municipal, provincial, and federal. I tend to believe that and agree with that. And so I believe that the system that was in place, and I'm still thinking is currently in place, was not a good one, because it seemed like, sorry to be blunt, everybody and their dog was after money and trying to provide the service and thinking they were the best at providing the services that we're needing. So I just want to make sure that I'm understanding and that I've picked up correctly from your presentation. What you are saying, I think what you're saying, and correct me if I'm wrong, is that fixing the system that exists today and working together, whatever that means, is the answer. So if I've understood that, then please say yes or nod your head. And maybe just to elaborate, what does working together in your vision, because we might all have different visions of what working together means. So you people that are doing this and doing all the work, the so-called experts, what does working together as being the answer mean? Can you elaborate on that, please?
So a great question, Councillor Morrow, and I'll give you a real world, real life example of working together. And so when we did our RFSQ, we have limited dollars that we use to fund different programming areas. And one of them, through our FCSS envelope, are children and families. And so we have a certain amount of dollars, and we do the RFSQ, and we get all these applications for delivering programs. And so recognizing at the very same time, the Ministry of Children's Services came out with an RFP for a lot more money, again, for children's services. And so not wanting to duplicate, wanting to coordinate and integrate to make sure we're getting the best value, I did connect. We tried very hard to connect with the Ministry of Children's Services. And it was challenging because they, for a number of reasons, couldn't share information on who applied and what dollars they were giving out. Well, that makes it almost impossible to coordinate, right? And so you multiply that by the many different ministries and levels of government, Justice and Solgen, Alberta Health Services, Children's Services, Ministry of Seniors and Housing. And we're not talking to each other. We're not coming together as a collective to say, hey, we do have a lot of money we're giving out here, but we're not at the same table. And then we all give out this money in isolation, and we have different levels of bureaucracy to give it out, multiple reporting plans where these groups have to complete hundreds of different reporting plans for every funding group. And the measurement and for return on investment, we're just not even remotely coordinated. And so this is broken. We've got to come together, all levels of government. And again, I'm going to use COVID as another example. An immense amount of dollars were flooded our communities, and the governments came out with these dollars extremely quickly with tight timelines and pressures, and it almost forces communities and groups to spend it very quickly. And it doesn't create, again, an opportunity for a strategic, evidence-based approach. We somehow have to do better.
Dr. Turner, did you want to add?
You're on mute, Alina.
Oh, thanks. I was just playing with the wrong button there. So I'll give a more maybe client level example and an experiment that we ran that is now being scaled. And sorry to dredge up the past, but it was actually an experiment that we ran with Archist and during when they were still running the supervised consumption site. And we said, hey, before we double down on this in the RFSQ, let's test out if this is gonna work with the most complex clients that we have at the SCS. So we brought teams together to say, who is the top user of the supervised consumption site? And then let's focus our existing resources on them. Let's do what it takes from a individual well-being perspective and come around as a community to support these individuals. So we did what was called like a blitz, essentially, where you just have a sprint to identify, engage, and intervene with that target group. And we targeted the top 5 supervised consumption site users at Arches at the time. We rehoused them within 2 weeks and brought down their public system use within a month by, I think it was 90%. So it works at that client level when you have a municipality that was down with change, when you had service providers that were also down with the change, police and health and housing providers that wanted to support that. That's with 5. So imagine that at scale. That's exactly what the CMHA contract is now focusing on, is doing that at scale. And then those were the complex clients. Now imagine how that works from a preventative perspective, so that we don't have to wait for them to be the top 5 supervised consumption users, that we can identify them early on, wrap around, blitz, get them reconnected and out of those crisis systems. It works. It's science. It's not even just science. It's just good sense and the ethical thing to do. But it requires leadership and it requires everybody working together. And the results are there. So that's what we're doing at scale through the municipal investments that you all championed for us to be able to do that last year. But now it's unlocking the 100 million, not just your 10 million per year, but how do we do that times 10? And that's where we need this next phase to really double down on impact and engagement with the rest of the community. Thanks.
Thanks, Dr. Turner.
Thank you very much. If I may, Mr. Chair, my final question, then I'll hop out. So I'm going to date myself here again. I'm going back to my early days on council, where the council of the day felt, and I know times have changed, but the council of the day felt that any type of social services was the responsibility of other levels of government and not the municipal level of government, because we only have deep pockets, and that's our taxpayers, and we have other commitments that we actually, owe them as far as providing all the services they require in the municipality. But I realize, time has changed. It's 25 years ago, and now we're into this, whether we like it or not, and we all strive for the betterment of our community. And so I guess my question now, since we're into this, even though there's a part of me that still feels that we should not be leaders because this is not our mandate, it's the province and the feds, but yet again, we need to be leaders if we want things to happen. So my question is, to whoever wants to answer it, how can we as council support this plan when I think we all know that the existing service providers, not only are they fearful of change, but they may oppose change, and they'll do what they can, even though in my mind, this plan shows that it could be better for the people that we are supposed to serve. So how do we deal with that? Because as council, we might follow one direction, but then we'll get it from the existing providers and they just don't want to buy in. So can somebody help me with that and maybe give me some comments or advice in that regard? Thank you. Thank you, Mr. Chair.
Thank you, Councilor Morrow. Who would like to answer that question? Mr. City Manager?
I'll take a start at it, Mr. Chair, if I could. And I think it's a great question, I think the answer was in the question, and that's change is difficult, and people often perceive winners and losers when you go through change. And I know, listening to Dr. Turner and Marty speak about this, they've called this transformational change, and we saw through CWSS Phase 1 that there was opposition to that change. And we've heard from Dr. Turner about and Marty about the successes that we've achieved because council made that decision and recognized that while difficult, it's important change. And I think that's really what we're looking for council to do again, is continue on this path that's been started down. But as we go through this, I think that the two ways that we address that resistance to change, one is we demonstrate success and we build on the successes that have taken place already. We recognize the quality service providers, the knowledge, the commitment that exists in the community, and we turn to them and look for them to help lead through this. And the second piece is just communication. And it's being aware that you don't impose change and then turn away, that as we go down this change journey, we need to keep the lines of communication open, take every effort that we can to hear from individuals who've got ideas and or concerns, and adjust as we go. So I think those would be my comments.
Thank you, Mr. Dalton. Mr. Mayor, I did have you in the queue, but you went off the queue. Did you have a question, Mr. Mayor?
Sorry, I forgot to put my hand down.
No, that's no problem at all. Councillor Hagan, or Acting Mayor Hagan?
Thank you very much, Mr. Chair. I first want to start by thanking Dr. Turner for a comment that she made earlier, that science is extremely important, but common sense needs to be part of this strategic approach. And so thank you for that, because I think that's extremely important. My question is for Chief Medizadeh. And I'm looking at this, and this is the third time I've seen this presentation. I'm just ecstatic every time that I hear of how this can be, and I know that there's going to be some challenges getting to that point. But I want to thank you all for this starting point that I hope we can carry forward with. As I was sitting here, Chief, I'd received a few some text, some pictures of some concerns of vandalism, etc., in throughout one particular neighborhood in our community. And as I'm listening to some of the different social strategies that are brought forward here, I want to ask you, I know that a lot of the time is spent on social issues currently with the police, which I believe is pulling our police officers away from doing the work that and responding in what many of our citizens believe would be a respectable time. And I know respectable time, I'm sure to most, is be here in 5 minutes or be here in 2 minutes, but sometimes that's not possible. Would you agree that some of these, with the strategy that we have going forward, would alleviate some of that concern within the community, and that your officers can actually do policing work and with the help of this particular strategy we have?
Absolutely, and that's the power of collaboration and accountability, that people come to the table and do their thing. And in fact, as you know, Councillor, from the commission meeting remarks, we actually, I'm proud to say, we did our first ComStat meeting yesterday. That even within the police department, because when you look at fragmentations, it can't even happen internally. That you look at, there's a lot of good work being done, there's a lot of good stuff that people want to do, but if they're doing it in a fragmented way, they still serve the community, they're still doing great stuff, but it's not going to, when you actually get all that horsepower and push it towards one channel, I think you're going to get much more return on investment. And that's what ComStat is going to, I'm hoping, bring to our table. So ComStat is a mini model of what we are talking about, is bring the issues forward, have the team members have a look at it, and somebody has to take the lead. Like yesterday's meeting, we figured that there's a few blocks area that there's a lot of property crime, vandalism, etc. going on. So the property crime unit is going to take the lead, but every other team lead has to support them what they can do to address that issue, which really brings the teams together. And now we are looking at a more common team approach on dealing with an issue versus everybody doing wonderful work every day all over the city, but kind of fragmented. So again, what I see here is that way that instead of doing it in silos, and again, I never want to bring down anything any of these community groups does. They're all doing wonderful work, and they're doing it with the right mentality to serve the community. But if they actually get rid of those silos and actually come together, work as a team, as I mentioned, I think a lot more can be accomplished with without having to put more money into the equation.
Thank you very much. I appreciate that.
Any other questions or comments from members of the committee? Any other comments from anyone else? Councilor Morrow?
Thank you, Mr. Chair. I guess maybe just one question to either Marty or Dr. Turner. Can you just help me understand a little bit more of the different levels of government and the roles and how much of a role each level of government should be part of this? Because again, I'm kind of thinking, you know, I'm sure that each municipality and all those councillors in the municipalities want to do what they can, but it always comes down to limited funds. So can I just maybe get your feel on the role of the three levels of government and how we can deal with all the issues we're talking about? Because I'm sure, well, it's all over Canada. So just help me out a little bit. Thank you.
Yes, Councillor Morrow. So I think between Alina, myself, and especially Craig Dalton, because he has a lot of experience at that multiple government level, but I'll give a really high level Marty version in that the vast majority of the responsibility for social services lies on the provincial government. So addiction and mental health, primary health care, mental health care, housing, homelessness funding, children's services, justice and Sol Gen dollars. You know, that's the, you know, a lot of that is the provincial mandate, correctional services. The federal government, you know, from a dollar perspective, their contribution is minimal. Alina can confirm this, but I believe it's less than 10% of that big pot. The municipal government, our mandate to deal with social issues is very, very minimal. We are sometimes given dollars through other levels of government to disseminate and administer, you know, like the homelessness dollars, the FCSS dollars. But it's quite frankly, addressing social issues is not the mandate of the municipal government. But, you know, like communities across Canada have found, you know, it's a low, you know, we're a local community. The city of Lethbridge gets blamed for all of the problems because we are local. And it's about, as Craig said, that, you know, somebody has to step up and at least convene and facilitate all of that, those dollars, to make sure that we can move ahead in our community. But I'm going to stop there and let Alina talk about, because she's very familiar with the very specific levels of government and their mandates and their dollars.
Yeah, for sure. And Craig was one of those provincial decision makers that has tried to really think from an integrated perspective. So he'll, I'm sure, have a perspective on this too. For, I guess, my thoughts on this is, and what we can do, we know exactly who's sending money down into Lethbridge now that we've done all this work. So we know exactly which department. We can narrow it down to like the actual administrator that's in charge of it. The crappy thing is that there's like 100 of them and they don't talk to each other. So The challenge that we have is that there's not a top-down mandate from GOA from the across ministries for the ministries to direct the administrators of funds, which are pretty downstream from they're major decision makers, but there's a big gap between the minister and what they might want to see and what happens, deeper into the various departments. So that is actually creating this fragmentation because there aren't mechanisms for them to know that they're actually trying to do the same thing in Lethbridge and actually going on top of each other and sometimes messing things up further. So they think everybody's well-meaning, right? Like just like we were saying before. And because they have their marching orders, they don't necessarily have the need or the mandate to talk to other components that might be working at cross purposes. So we've been toying around with, how do we get that sorted at that provincial level if we know the 90% of the cash is coming through provincial sources anyway, and the feds contribute primarily through the social transfer and so on. But is there a way that we can pitch at the political level, and that might be a consideration for council. This is now Alina's opinion, not Marty's opinion or Craig's opinion. So, but is there an opportunity to say, if you're going to send money down at the local level, you need to respect that local autonomy, or at least an ability for us to coordinate these various streams so that at least it's all going towards the same priorities. And if it's not, then at least we know we have a rationale for why, and we can ensure that it's not creating barriers downstream. Because again, you're the government that's closest to the ground. You're getting the phone calls and the texts, and at the same time, the ministers don't necessarily have the mechanisms right now to direct funding coordination. And it really is if you can control or coordinate the funding levers, that's I would say a big chunk of the challenge, because that's at that point we could introduce something like unique client identifiers so that we know exactly who needs what and match services to clients more effectively. We know exactly where we have gaps from a service perspective. We know how we can move money around because we can respond to the customer, the client, as opposed to what the funder thinks is needed in Edmonton. So I guess local autonomy, or at least some say in terms of coordinating the funding coming in from the province, would be amazing. Ministerial directive or a premier's directive to ministers to support that type of a mechanism is not going to just benefit Lethbridge. It would benefit every single community in Alberta that's having the exact same challenges, and could set the stage for something really transformative then. But I'll punt it over to Craig, who knows this inside and out.
I would just say Marty and Alina nailed that. I would just emphasize Alina's final point that as a city, we're the end receiver of all these services. And so if they're not coordinated and delivered in a way that works, we're left holding the bag, so to speak. So I think that what we're talking about here is, as Dr. Turner said, that transformative approach of being in a position to say to the funders and the other levels of government, hey, this isn't working. We're putting in place an approach to coordinate, facilitate, convene. Please respect the perspective of the community, and let's work together to get the best out of the investment into these areas. So I think they nailed it. I just would like to emphasize that I think we have an opportunity here to demonstrate that there's a better way. And to Dr. Turner's point, I think from a provincial perspective, they would really welcome that.
Thank you, Mr.
Thank you all very much. Thank you all very much. I also heard that Mr. City Manager, looks like you've been around the block, so we got a good guy here leading this process, I hope, huh? Thank you, Mr. Chair.
Yikes.
Any other questions? The one takeaway I did get from this is I think council, this committee, would like to see some time guidelines in regards to when things are going to be done. And then from there, going back to the mayor's points, is timelines and then action plan. And I think that's something that can probably happen in the next month or two. You could probably report back to us in regards to exactly when if not earlier. Does that sound fair, Mr. City Manager?
I'll ask, again, Marty and Dr. Turner weigh in, but what the timelines that we'll bring back when we're finished the engagement on the options is around setting up and implementing the action table, action committee, whatever we call it. I would then see them, it's going to take them some time to get their feet underneath them while they're continuing to work. So I would see that committee eventually coming back to, or that action table, whatever it winds up being, coming back to this committee and saying, here's our plan, here are our timelines. That's how I would see it unfolding. And this does not stop. I mean, the first time this, to the chief's example of that neighborhood with some vandalism, that does not stop. This is not kicking the ball down the field or down the road for a year, kicking the can down the road for a year. This does not stop that committee from saying, okay, what are the most pressing priorities or opportunities that confront us now? What can we do in the next 60, 90, 120 days? But I think it would really be that committee, that action table, that would need to take some time to work through that plan and bring that back to this committee.
And thank you. And I just want to just say one thing is, sometimes when we get into these kind of strategies or plans in an election year, sometimes people think, well, we'll just wait for the new council. It's business as usual. It doesn't matter who sits around this table come October. This is going to happen and occur. And just because there's an election year, it doesn't mean we take the foot off the gas pedal in any way. And I think that's probably, I think I speak on behalf of all my colleagues when I say that. Thank you very much. Any other comments or questions? Perfect. I want to thank Dr. Turner, Marty, the chief, Mr. Dalton. Looking good there, Mr. Fox, for your presentation. I have a following resolution here. Can I get a mover on this? And this is 4.1. This is I'll just read it and I'll ask if anyone would like to move it. I'm guessing I'll have a hand raised. Community Wellbeing and Safety Strategy, CWSS 4.1. Be it resolved that the Community Safety Standing Policy Committee recommend that Council receive the Community Wellbeing and Safety Strategy Phase 2 report as information. Can I get a mover on that, please?
Higgin.
Councillor Higgin, thank you. Councillor Higgin, did you want to, it's a resolution, it's moved by, is there any questions in regards to 4.1? I'm guessing not, since we just did a roundtable on this, but did you want to just introduce your resolution or just call the question? It's completely up to you, Councillor Higgin.
Yes, thank you very much, Mr. Chair. I do want to just thank everyone for the collaboration effort. I'm glad to see our Chief of Police here, as well as other key stakeholders, throughout our community. So I want to thank, first of all, for that. I do want to also say that I'm excited with the social asset mapping and how it will help with the duplication of services that we've heard for many, many years. And I know I haven't been on council as long as some, but I know throughout the time that I've had in the 7 years and a bit, it's a question that's always come up. And I've really seen that over the time. I believe that when we have this duplication of services, the end user or those that are requiring those social services at the, get less provided for them because it goes to administration costs, etc. So I think that's really important for us to know, and that's a big takeaway from this each time I listen to it, is how important that is to get that funding to those that need it most, and understanding that there needs to be administration involved in this, and there's going to be costs there. But the duplication definitely does take a lot of those costs away from the those that require the end user, I guess, and those that are requiring the services. So thank you very much for the presentation. Again, like I said, I'm really happy every time that this comes up, and I've had the opportunity to sit in this a few times. And so thank you very much. And with that, I will, if there's no further debate, I'll call for the vote.
Is there any further debate? Seeing none, I'll call the question. All those in favor? Opposed? I'm guessing unanimous unless I hear otherwise. Thank you very much. And before we adjourn, I just want to once again welcome Mr. Fox to the team. And also I want to thank Mr. Adair, because this is the kind where you're passing the baton on to the next individual. And thank you once again, Mr. Adair. And thank you to all the presenters as well. I know we'll be seeing your faces around in the months and weeks to come. So thank you very much. Do we need a motion to adjourn? Councillor Campbell, can you make a motion? Would you like to sign off on the motion to adjourn today's meeting?
Sure. But first, I just want to let the record show that Mr. Fox had the nicest tie of the day. Thank you.
It has been recorded.
With that, I'll ask for adjournment.
All those in favor? Opposed? Thank you very much, everyone.
Thank you.
Be safe.
Thank you very much, everyone. Thank you.